today we're going to talk about preparing for surgery, or how to prepare for surgery, and perhaps the most stressful time before, which is the day before surgery. I want to make sure this is an easy process for you and you are at ease in those stressful moments. So here we go. First thing is things that you should get prior to surgery. So there are certain things that you will need at the beginning, especially if you're having, for example, a body procedure performed. And there are things that ease your movement in the house. A lot of people prefers to sleep for the first few nights in a recliner. So this is something that you can do, or even at a bed that has several pillows where you can be semi-sitting. And this is something that puts a lot of stress or less stress in your back and in certain areas, and allows you to recover a lot faster in those first few days, which are usually the most difficult ones. Now, there are things that you should get, for example, a bedside commode or other devices that will help you with all the first activities that you have to perform while you are recovering in the first few days. That will ease your going to the bathroom, for example. Another thing is stairs. Stairs is very important to consider because at the beginning, you don't want to go up one or two flights of stairs. So people prefers to stay in the lower levels to avoid having to go up or downstairs. Other things are clothing. Clothing is very important because it has to be comfortable at the beginning. Remember that you will be having perhaps drains or incision lines, and you don't want anything rubbing in these incisions and make you uncomfortable. So comfortable clothing is very, very important. Now, the day of the surgery, or even hours before surgery, is that you remain without eating or drinking. We call it an NPO status, but that means that there's nothing to eat or drink prior to surgery. And this is extremely important, and I explain to you why. Especially if you're going to be having general anesthesia, but even if you're going to be having some sedation, it is possible that if you come to surgery with a full stomach, during the induction portion of the anesthesia, you might aspirate, or some of the fluids from your stomach could go into your lungs. And that is a very, very dangerous situation because it's almost like drowning. And it's extremely important that you don't have neither solids or liquids in your stomach. So nothing to eat or drink for at least 6 hours or 8 hours before. And if you're going to do only liquids, you could perhaps drink some medicines with a sip of water. That is no problem, but make sure you don't get a full glass of water. Prescriptions. You should have all your prescriptions called in and ready prior to surgery to avoid having to go to the pharmacy or make any delays in taking the medications. And a healthy grocery shopping is very important. Remember, after general anesthesia, you're probably going to feel nauseous, or even in sedation, you might feel nauseous immediately after. So you don't want to have a full stomach or eat a lot of greasy food. It's important that you keep a healthy diet, drink some soups, things that are easy to digest, and keep your proteins up. That is important for the healing process and immediately after surgery to avoid any other complications like nausea and vomiting. And in terms of constipation, which is another big problem after surgery for taking a lot of pain medicines, it's important that you keep a healthy diet, a lot of fiber, and especially a lot of water. It's important that you drink a lot, not to become dehydrated, and to avoid becoming constipated or having problems going to the bathroom. Now, the most important part, I think, is perhaps avoiding stress. It's stressful, I know, especially if you are going to be undergoing surgery for the very first time. But try to avoid things that will make you stressed. For example, watching YouTube videos about the procedure you're going to get, that makes you stressful. So avoid that. Ask your questions, add all the questions you have. It's important that you are well informed about the procedure, but avoid stressful behavior. And perhaps switch that for listening to relaxing music, and trying to relax as much as possible all those first few hours before the surgery. I think this is very important because we want you to have an uneventful path throughout the surgery in the perioperative period, and we're going to try to ease this and make this as comfortable as we can. I hope you enjoyed this video. Give it a thumbs up, share it with your friends. Check more for magicsurgeon.com and the website. You have a lot more information on how to prepare for the different procedures. There are different things you can do for different procedures that you're going to have. And then I will see you next week in a following video. And always remember, believe in magic.